all. This is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So the discussion today is about the long COVID. I have the data from UK. We also have some studies from Italy, France, and Germany. I have done some data extrapolation for the US as well. So let's look at today. The primary discussion I want to do is the prevalence, that is presence of the disease in a cohort or in a group or in a population. We will do a deeper dive in these different clusters of symptoms later on. So let's start our discussion. So here, this is drbeen.com. In the description of this video, there is a link that offers you drbeen.com access to 800 to 1,000 videos, almost free. So check it out. I think you would like it. This is the study which is about the symptoms. I'll use some part of this study. The main data that I want to share with you is this one: prevalence of ongoing symptoms following coronavirus infection in the UK, 7 April 2022. In addition to that, I want to go over this outpatient long COVID data. This data actually has a very interesting point in here in this study, and that is which symptoms, when present, indicate a possibility of long COVID occurring later on. Then this is a study which says that UK believes that 10% of the COVID patients have long COVID. My analysis with their data is that they are saying about 8%. So we'll see. This is UK's population. This is, population, I mean the number of cases. And this is US's total cases. I have all this data present in our presentation. So let's start from there. And I hope that this mic is working okay. My previous mic broke down. I tried another mic yesterday, my son's mic, he took it back. So I brought this mic in today and patched it together. I hope it is working and it is sounding okay. This is the first time I'm using it. Okay, so let's start our discussion. So medical disclaimer, this is not a medical advice, no disclosures. This is an older painting, which I just found again, and I put that here. The title is Lion's Mane. We are living, just for information purposes, we are living in Omicron XE time or era. So we have a combination of BA1, BA2. We have a lot of BA2 plus the XE. Now, here is a study, here's the data really from the UK Office of National Statistics. Prevalence of ongoing symptoms following coronavirus. So they sent out a survey with this question. The question was, would you describe yourself as having long COVID? That is, you are still experiencing symptoms more than 4 weeks after you first had COVID-19, more than 4 weeks, that's the definition. And those symptoms are not explained by something else. So that is the UK's definition of long COVID. You had COVID, then 4 weeks after, you still have some symptoms and you do not know what caused it, or they're not explainable by other reasons. And that is the survey question. So let's look at the characteristics. The characteristic was all of these responses were self-reported. So that would become a weakness of the study as well, because it is not a clinically diagnosed long COVID. This is a person reporting that I had COVID and I have symptoms. And this data is up to 5th March of 2022. Question in the survey, we already saw that. Then the cohort characteristics. Margaret is saying sounds great. Hope you're happy with it. I would be once I listen to this talk later on, but if you are all able to hear it correctly, then all good. So again, this is a prevalence discussion, so that it's not a symptoms discussion. It will be what percentage of people become long COVID and what are the most common symptoms. Then we'll go into the actual symptoms at a different time. Now, cohort characteristics, this is the UK data. This is the data from the people who are living in private households. That means it excludes communal establishments, for example, halls or residences or prisons, schools, hospitals, daycares, and so on. Oh, sorry, old care homes and so on. So, for understanding this data, let's look at the UK's total COVID cases. So, on April 5, UK had 21.48 million, 21.4, let's call it 21.5 million cases. Now, overall prevalence. In this discussion, wherever you see this box, that is my extrapolation. That is not coming from the study. So the study says an estimated 1.7 million people, 1.7 million people, which they say is 2.7% of the population. Now, this is not all the population. This is the population of those people who live in private homes, meaning they're not in the communal centers. So that population is about 6.29 million, sorry, 62.9 million. Total population for UK, I believe, is about 67 million. So out of the private households population, 2.7% of the total population is suffering from long COVID. That's a big number. Now, if you look at the cases, this is the data that they did not provide. If you look at the total cases, let's say 21.4 million or 21.5 million, out of those 21.5 million, if there are 1.7 million long COVID patients, then that is 7.94%. About 8%. Some reports say that UK says about 10% of the COVID cases, outpatient cases, become long COVID. It's still 8 or 10, very high number. Look at the number, it goes in millions. These millions of people are suffering. Now, this is very interesting. Where is the prevalence? I had thought that maybe the prevalence is more common in the older or the patients with the severe disease. Although a different study later on, you would see that severe disease for hospitalized patients, they actually have a propensity to have long COVID more than 80% of the patients. Here, we are talking outpatient mainly. Age range, most prevalence of long COVID was in the age 35 to 49. Females had more long COVID. And that can actually be understandable because females' immune system is usually more aggressive, more active. And that is why autoimmunity is more as well in the women. And so here the long COVID is more prevalent in women as well. Then people living in deprived areas. And that may be something to do with the hygiene plus the dietary controls and systems plus nutritional statuses, vitamin D's, diabetes, and so on. Those working in social care, teaching and education, healthcare, then people with comorbidities or disabilities. These are the groups that had higher prevalence of long COVID. So once again, age 35 to 49. To me, it seems like COVID has gotten something for every age. It just is such a nasty virus. Now, if I try to extrapolate that for the US, so this is my extrapolation. If we take the numbers, 2.7% of the population, or about 8% of the COVID cases, and then we try to extrapolate them for US, although they are not comparable, but let's just try to have an idea. So US total cases, 80.45 million today. And if we extrapolate it at 2.7% of the population, and that is 330 million. Remember, UK's population was households. Here I'm just using the whole population, which again is not the right number to do. If we do this, all the populations 2.7%, that is about 8.91 million. Let's use that as the upper bound. And then 7.94% of the COVID cases is about 6.35 million. So anywhere from 6 to 9 million patients may be in the US right now suffering with long COVID. That's a very large number. And you would see that about 40% feel enough severity of the long COVID that they are not able to work successfully or correctly or more continuously. Their day-to-day routine is disrupted, but for 40 or more percent, it's actually almost like disability. So the findings, going back to the UK report, the findings were, of the people who self-reported that, hey, I have long COVID, 69, and these percentages are not to be added, 69% or 1.2 million people out of 1.7 million had COVID at least 12 weeks earlier, less than 12 weeks. No, sorry, let me back up. 12 weeks. They had COVID about 3 months ago, and now they still have symptoms. 69%. 45% had COVID 1 year ago. So they're suffering for a year. And then I'm going to go to the bottom line first. 4% had it for 2 years. And then 24% lesser than 3 months, that is less than 12 weeks, 2 months, or 1 month, 1 week, 2 weeks, and so on. At least more than 4 weeks. Now, the 2 years is sad and good both. Why? It is sad that there are people who are suffering for 2 years. It is kind of good in this sense that if you look at the numbers, after 3 months, there was 69%. And if you see after 2 years, there are lesser. So maybe over time, patients become better anyways and gradually. And I have seen that as well. Over time, patients do become better. I actually got somebody's question. They said, all this discussion of long COVID management and the protocols and the treatments, isn't it true that the long COVID just starts to resolve by itself, even if it is slow? So maybe all these protocols are just useless. The clinical observation that I have made is that patients start feeling better. There are some who do not, but most patients starts feeling better. However, with the management or with the help, that time to feel better starts becoming accelerated. Then again, of people who reported long COVID, this is very interesting. Look at the variants who caused long COVID and their percentages. The most deadly for long COVID, for causing long COVID, was original Wuhan variant. Second deadly, so original Wuhan variant infections, 33% became long COVID. Second was Delta, 27% long COVID from Delta. Third is Omicron, 19% Omicron patients. So 19% long haul patients were from Omicron, and then 15% from Alpha. So there's a question that's filthy, says, what stats on long COVID between vax and unvax? Don't have them. So I'm reading the stats from the Office of National Statistics. They may have them in their data. I did not look at the data itself. I'm looking at their notes that they had published. So, and Natasha says, at least I can get out of bed. I wish you well, Natasha, and soon. So once again, Wuhan, Delta, Omicron, Alpha. Then people with day-to-day activities, adversely affected. 67% of these folks who reported that they had long COVID, 67% had some side effect, some symptom, and they said my day-to-day activity is disrupted or adversely affected. That's the term they used. 19% or 322,000, they said their ability to undertake day-to-day activities had been limited a lot. These are the patients, and I know many of them, who said, I cannot go to gym, I cannot get out of my home. If I walk a little bit, I get tachycardia, I get so confused, I get disoriented, I have a balance issue, I am so tired, I'm lethargic. So there is a bunch of symptoms that they are not able to get out of bed or not able to function correctly for those functions that they were doing okay before. So it is not that they just became aged enough or they had some comorbidity. They were functioning correctly. And all of a sudden, this is their situation. Then most common symptoms. So again, we're not discussing the total symptom set. That runs in hundreds. And I'll do a follow-up talk about that. This is the most common symptoms from the Office of National Statistics from UK long COVID self-reported data survey. 51% fatigue. And I'm seeing that majority of the long COVID studies show fatigue as the most common. 51% fatigue. 34% shortness of breath. 28% loss of smell. 24% muscle aches. So these three, muscle aches or loss of smell or shortness of breath, they in various studies go up and down. For example, some studies say loss of smell and taste is more prevalent than the shortness of breath. But fatigue in all of them is number one. Sasha says that, surprised that tinnitus isn't there. You're correct. Tinnitus should be there. And maybe as more studies come out about Omicron, and as I read more studies, at least the UK's latest report doesn't have tinnitus, maybe tinnitus subsides easily. So my tinnitus has actually gone from the Omicron. However, every re-exposure gives me tinnitus for a day or so, and then it dissipates again. Interestingly, I get the ear congestion as well. Even nowadays, when I had this cough and everything, I did get ear congestion too. So it is interesting that tinnitus is part of it. Maybe it doesn't become long COVID. If it doesn't, it's a good thing. Now, once again, I wanted to remind us, greatest prevalence, 35 to 49 years, females, people living in more deprived areas, those working in social care, teaching, education, healthcare, people with comorbidities or disabilities. So that is the UK data. I have more studies, so let's continue. Now this is, so UK data done. What is the takeaway over there? About 8% of the outpatient patients can become long COVID, or 2.7% of the whole population has so far become long COVID. And the most aggressive virus for the long COVID was Wuhan variant, then Delta, then Omicron, then Alpha. And of course, the younger 35 to 39 to 45 and females, more prevalent there. Okay, now severe COVID and long COVID. This is a study that had, so once again, the time here is 2020. So this is not a recent study, this is an older study. I would find some recent studies too. They had 179 patients. Out of them, 143 were participants, others did not respond. Mean age was 56.5. The age range was 19 to 84. 37% were women. They were all severe, so they were all hospitalized at some point or went to hospital. Mean hospital length of stay was 13.5 days. 72.7% had interstitial pneumonia, the lungs, walking pneumonia, as we say. 15% had non-invasive ventilation, and 7% had received invasive ventilation. That was a profile. Now, check this out. In these severe patients, when they followed up after 60.3 days, more than 2 months, 12.6% were symptom free, 87.4% still had some sort of symptoms, 32% had one or two symptoms, and 55% had three or more symptoms. Excuse me. 44.1% had worsened quality of life. And you would continue to see this 40% or more with the disabilities or something like disability. You saw that here as well, I believe. Here, if you say people with day-to-day activities adversely affected in the UK report, 67%, and then 19% who said a lot. So here you're seeing 44%. Now, what are the most common symptoms in the severe patients who become long COVID? 53.1% fatigue. Remember in the UK report, 51% fatigue. Then 43.4% dyspnea. Over there was shortness of breath as well. Then joint pain and chest pain. Here, because it's an older study, anosmia and taste issues are not here. Then there is a study, the link is in the description, long COVID in France. So printed in Nature, published on 5th April, course of post-COVID-19 disease symptoms over time in the compare long COVID prospective e-cohort. So there's a study. What did they say? This is actually, there are a couple of very interesting things in this study. So they said, we analyzed, or let me back up. First, they said about 10% of the people infected by severe acute respiratory syndrome experience post-COVID disease. So 10% they claim in France. They said we analyzed 968 adults. Day-by-day prevalence of post-COVID-19 symptoms was determined from patients' response to the long COVID symptom tool, a validated self-reported questionnaire assessing 53 symptoms. So this was also a self-reporting tool, an app possibly. Among patients symptomatic, after 2 months, 85% still reported symptoms 1 year after their symptoms onset. So those who had initially symptoms lingering up to 2 months or more, they then continue to have it for a year or more. So that is one indicator. Then evolution, this is a very interesting point. Evolution of symptoms. So what happened to symptoms? Did they decrease? Did they stay the same? Did they go away? Or did they become intense? Evolution of symptoms showed a decreasing prevalence over time for loss of taste and smell. So those who had loss of taste and smell, their taste and smell started recovering over time. A stable prevalence of dyspnea, the shortness of breath stayed the same, did not improve over time. And then an increasing prevalence of paresthesias, the incorrect sensation, the pins and needles, the burning sensation, the touch feeling and irritations, and those paresthesias are abnormal sensations. They kept increasing with time. And we have been doing some studies in the past few days, like yesterday's study, which can shed some light. Again, that yesterday's study was about vaccine. I think we can extrapolate that to the virus itself as well. These can shed some light for why this can continue to happen and maybe even increase. The disease impact on patients' lives began increasing 6 months after onset. 6 months after onset, the impact actually increased. Our results are of importance to understand the natural history of COVID-19 disease. So this is the data from France. I believe this study is from Germany. Study identifying symptom set associated with long COVID. So just like here in this study, they said that if somebody had symptoms for 2 months, then they had a propensity to be long COVID even after a year. So that's kind of an indicator that this person is going to become long COVID. This study also shows some propensity for long COVID. So this is European study, 958 patients, I believe, German study. And again, this is also an older time, 2020 study, printed in July 21. So here we identified anosmia, ageusia, fatigue, or shortness of breath as most common symptoms. So look, anosmia is starting to come in. In the 2020 long COVIDs, anosmia was not seen. In the 21 long COVID, you are now seeing anosmia creeping in. So the newer variants started causing anosmia-like things. Persisting symptoms at months 4 and 7. And summarize presence of such long COVID in health consequences as post-COVID syndrome. So what I wanted to show in this study was the following. So we observed 442 and 353 patients over 4 and 7 months after symptoms onset. 4 months post SARS-CoV-2 infection, 4 months. 8.6% of the patients presented with shortness of breath. So if you see here, this is 21 study, 2020-21 study, showing shortness of breath as 12.4%, sorry, 8.6%. Then anosmia, 12.4%. Anosmia, higher than shortness of breath. 11% ageusia and 9.7% with fatigue. So here, if you see, fatigue was actually the third out of 4 most common symptoms, and anosmia became the most common. At least one of these characteristic symptoms was present in 27.8% and 34.8% and at month 4 and 7. A lower baseline level. So check this one out. It's too interesting. A lower baseline level of SARS-CoV-2 IgG. So those patients in which IgG production was lesser, or who had anosmia, or had diarrhea during COVID, were associated with higher risk of developing symptoms. So there are a few clues over here. What are the clues? From UK study, 35 to 49 years, female, deprived areas, working in cohorts or social works. That means more exposures. Disabilities, comorbidities. That is one indicator. Then you saw the indicator that symptoms continuing for more than 2 months would have symptoms after a year as well. That's the second indicator. Third indicator, the presence of anosmia or diarrhea or low levels of IgG were also associated with higher risk of long COVID. So this is the discussion for today. I am actually also pleasantly surprised that tinnitus is not there as a long COVID, because I don't want to wish tinnitus on anyone. And so it is good if it doesn't become long term. So this is the discussion. Please do me a favor. In the description of this video, there is a link that offers you access to drbeen.com at a very affordable, reasonable price. It's not even the price of 2 lunches. So take advantage of that. And then if you would like to support this work, there is a link to buy me a coffee, or you can use PayPal, or you can become a patron. Thank you very much. And I would see you on the Chit Chat channel in a few minutes, and we will do some drawings and discussions. Thank you very much. Bye-bye for now.